Over the past 2 weeks, our team of 5 Monash University biomed students visited 2 of the most crucial hospitals for the community and indigenous people here in Valencia City, Philippines. We first visited the German Doctors Hospital, situated in the heart of Valencia City, whose doors are open to serve those most in need.
Hello, my name is Edison, and this year I am a third-year biomedical science student.
Hi, my name is Sarah and I'm a medical student from Monash University.
Hi, so it's Tom Frawley here, biomed student from Monash.
Hi, I'm Yi Ting and I am a science and biomed student at Monash University.
So today we've spent the day at the German Doctors Hospital and it's been really eye-opening. One of the first things we did was went on the clinical rounds this morning and we were told about some of the patients and some of their struggles, especially financially. And I think that already shocked me because these same decisions to be made don't happen in Australia. So to see these things is just like so humbling to me.
So the most memorable thing just throughout this whole tour of the hospital today is how prevalent TB cases are in just the city of Valencia, and knowing that a lot of patients they receive treatment, but because due to the living location being so far away from a treatment centre or from the hospital, they rather wait at home until the symptoms get worse and then to come into the hospital. And that just really saddens me how even though healthcare is free for TB treatment, it's so inaccessible to people of Valencia and everyone in Pinoy as well.
These children range from the age of 1 to about 4, and yet all had body weights of 4 and 10 their size ratio. It was clear to see straight away that with the German doctors pulling out of the hospital here, funding and resources have severely been affected, and that was evident in every experience we saw today.
We chose to visit the German Doctors Hospital because they were undergoing a challenging transition. For the past 25 years, the German government had funded the operations of the hospital. But when that contract ended this year, the hospital was left under-resourced, understaffed, and struggling to find funds to sustainably serve the poorest members of the community for free. It was eye-opening for us all to see that without the simplest of medical resources, the doctors here really weren't able to treat patients who came in already with the most severe diseases, like TB and pneumonia, or with extreme asthma, gasping for their next gulp of air. It made no sense that what stood in the way of treating these patients in pain was just not having a face mask or nebulizer machine, which we so thoughtlessly throw away every day back home.
Is the efficiency that the doctors here operate with. Every single patient goes through a test, they come back, they get the exact medicine they need. Nothing goes to waste here. And in the morning we punch through maybe like 30 patients in the morning. It just goes to show how effective this kind of altruism by these doctors who give up their time, their money, really does.
And so, we spent days meeting with local government and city health officials to better understand the context of healthcare issues in Valencia City. Then we spent time observing and working with the nurses, doctors, and patients at the German Doctors Hospital to try help solve a single problem for them. Speaking to local hospital staff, it was clear that the biggest burden eating up most of the resources at the hospital was the absurdly high rate of recurring patients coming back with the same disease conditions time after time. Pneumonia, UTIs, and malnutrition in babies being the top recurring conditions. Compounding this problem was obviously the severe lack of resources to treat their asthmatic and infectious disease patients.
One of the biggest problems being some of their communicable diseases really reoccur in the same patients over and over again, because by the time they get home, they're exposed to the same parasites in the water and the same pathogens in the community. And so something that we really want to try and help is how do we stop those reoccurring incidents of the same disease happening in the same patients.
So, what did we do? Well, first we had to stop the spread of disease within the wards of the hospital itself. With limited space and rooms packed with contagious patients, people who were otherwise healthy were also at risk of contracting infectious particles through the air and from uncovered food in the hospital wards. So we created an activity to encourage contagious children to wear face masks in the ward. We sat down with them with a surplus of colourful textures, stickers, and a bunch of face masks for them to decorate and design themselves. By making their own face mask, it allows them to express their creativity and a chance for us to educate them as we use the activity to teach children and their parents how face masks can protect them.
We spoke to the nutritionist and in-house hospital chef and applied some strategies rooted in design thinking to tackle the issue. This included identifying the need behind the problem and brainstorming potential, realistic solutions that were catered for such a need. We decided to purchase lids for all the food trays, and as a result, this would stop the transmission of infectious particles from patients to their food. As a further precaution, we took the opportunity to leave a facetious message in the form of a sticker stuck onto the lids to remind patients of personal hygiene and to wash their hands before eating.
Then there was the malnutrition problem in babies. From the very first day, we walked into a paediatric ward, seeing 3 malnourished babies with their skin visibly drooping from their bones. We later found out that these children hadn't come into the hospital because of their desperate malnutrition, but rather with pneumonia and other commonly defendable infectious diseases. The mothers actually had no clue their babies were even malnourished. So, the team set out to help newborn mothers understand what actually defined a normal, healthy baby, compared to one that was suffering from malnutrition. The next question was, how do we achieve this? How could we help mothers identify this issue themselves? After nights of brainstorming and prototyping, we turned to a Filipino staple, the rice bag. We then converted this once discarded bag into a new, inexpensive, and accessible measuring device, which enabled mothers to assess their child's height and weight every birthday. Mothers simply had to lie their babies on the rice bag and could instantly determine whether they were growing at a normal weight corresponding to their age. As a team, we used complex problem-solving skills to develop a cheap pilot program that has the potential to affect genuine change to this reoccurring issue.
We then visited the San Fernando Provincial Hospital in the mountain area an hour away from Valencia City. Situated in a more rural area, the hospital mainly served indigenous people from the tribes in the mountains who would have to travel 4 to 5 hours on average just to make it to the hospital.
So today we toured around San Fernando's government-funded hospital. We went around all the wards to observe how the doctors and nurses work together and what facilities and equipment they have. We had a chat with Dr. Ivan, and it was very eye-opening to see the things that he deals with on a daily basis, knowing that there is a short of staff and he has to look after the emergency room, looking over, doing rounds at the wards, and also writing prescriptions for all the inpatients and outpatients.
Today, the most memorable thing for me was definitely helping to deliver a baby, and it was also kind of sad to see that the conditions of the mother delivering is just completely different to anything that we would ever see in a hospital in Australia, but delivering a baby was so cool, and then the nurse let me vaccinate the baby as well and present it to the mother, so that was really special.
We were again fortunate enough to observe and learn from the staff at San Fernando, who divulged that the biggest burden for their hospital were the reoccurring patients coming back with the same preventable diseases of pneumonia, gastroenteritis, and cysticercosis. During our time shadowing doctors in their consultations, we were shocked to discover the gravity of the understaffing issue. Indigent patients may wait entire days just to be seen by a doctor, and once in consultation, the doctor spent just enough time diagnosing the patient's health concerns and then over 15 minutes filling out obligatory paperwork to claim no billing health insurance for these indigent patients. Meanwhile, the patients would have to wait in silence as the doctor filled out their paperwork with no further information on what's happening.
Today we witnessed the issue in the backlog of the emergency room, having only 3 beds and 1 doctor, and severely understaffed with nurses at any one point, meaning that for every few minutes spent during OBS by the general doctors here, 20 minutes of PhilHealth paperwork had to follow.
So definitely compared to yesterday, the amount of paperwork that the doctors here have to do to make sure it's all legitimate, the amount of red tape they have to go through to make sure they get their medicine allocated to them from the government, it really is a stark contrast to what we saw yesterday at the German Doctors Hospital, where they fund all their own medicines all in-house. We saw how yesterday how efficient they were compared to here, and you see a doctor is consulting one every 30 minutes maybe.
So, we set out to change that reality. During those 15 minutes, we believe we could easily communicate and educate patients on the condition they were suffering from. We designed eye-catching educational posters which were put all around consultation rooms and waiting areas. These posters were easy to understand and a fast way for doctors to inform patients on how to prevent reinfection.
What was especially unique and by extension rewarding about this health education mission to Valencia City was the opportunity to take knowledge that had been imparted onto us during our degree and create a tangible impact every time we saw our trailers used during lunch service or a patient reading our posters in the waiting room. We were certain that we had made an effective, positive difference to this community.
Basically, use the skills we've learnt in biomed, such as being able to make an infographic that we learnt last year, or some of the knowledge we've used in public health, and it's been very satisfying to apply that sort of knowledge and actually use it somewhere where we know it will be helpful to someone.
I've been blessed to experience the different cultures here. Everyone is so welcoming, and I just felt at home for the last 2 weeks. It's been such an incredible experience to just be able to have some hands-on practical skills working at the hospital, from administrating medication, wound dressing, or even just talking to patients. Since we're biomed students, we haven't had the opportunity as part of our curriculum to have placements or internships in any part of clinical setting. So if you're a student and you're wondering if you want to do this or not, I would highly recommend. It's very rewarding.
Overall, this has been an incredible trip for me. Personally, it's reaffirmed my passion to want to work in the medical field and to help others where it's needed most. The people of Valencia are truly wonderful people, and their hospitality has been seriously welcoming and looking after us at every stage. I think this trip is seriously useful and undeniably valuable for anyone who's studying biomed, or for anyone who's found themselves with a bank of knowledge essentially we've been taught at university, be it public health or expertise otherwise, but we haven't actually had the ability to use it yet.
I'm just so grateful for the people here in Valencia as well. I'm so thankful for everyone who has reached out, who's helped us to understand their community better, and who's let us in, opened their doors, let us make a difference. I'm really grateful.
And today, just to be able to see people's reactions as the posters went up, and the cafeteria woman serving out food on trays that we had designed and created to keep their food safe was the most rewarding and fulfilling feeling.
Our first mission to Valencia City showcased the possibilities available to make a real difference within a community willing to ask and accept much needed help. We're so proud to have been invited into the lives and workplaces of so many locals willing to share their lives and expertise with us. The experience really highlights the essence of working together, that alone we can only do so much, but together we can do so much more.
And in the future, we hope to offer this incredible opportunity to make a real difference to more students and invite you to join future journey with us.